Heart failure is not just a medical term, it's a growing crisis that threatens global public health. More than 6.2 million adults in the United States live with this condition, and that number continues to rise each year due to population aging and sedentary lifestyles. Traditionally thought to be a disease of older adults, heart failure is now increasingly seen among younger individuals and disproportionately affects minority communities with limited access to medical care. According to the 2024 report from the Heart Failure Society of America, what's most concerning is that mortality rates in these groups are rising. The reality is alarming. The CDC reports that about half of all people diagnosed with heart failure die within 5 years. The risk increases even more if factors like high blood pressure, diabetes, or high cholesterol are not well controlled. But there is hope. Early detection can make all the difference, improving survival rates by more than 50%. The body rarely shouts its warnings, it whispers them through subtle symptoms. Many people mistake these signs for stress, fatigue, or normal aging, when in fact they can be early alarms of something much more serious that requires timely medical attention. This video is not meant to cause fear but to empower you to take care of your heart health. We'll uncover 12 early signs of heart failure that are easy to overlook but crucial to recognize. They may not look like the dramatic chest pain you imagine, but they are just as important. By learning to recognize these signs now, you can protect your health and act before it's too late, reducing your risk of hospitalization or severe complications. Disclaimer: this video is for educational purposes only and should not be considered medical advice. Always consult a licensed healthcare professional regarding any concerns about your health, medical conditions, or treatments. All information presented has been carefully researched and verified. You can find the sources in the video description, including references from the American Heart Association and the CDC. 1. Shortness of breath during exertion. The most common early sign of heart failure is shortness of breath during activities that used to be easy. It occurs when the weakened left ventricle can't pump blood efficiently, causing fluid buildup in the lungs and reduced oxygenation. At first, it may appear when climbing stairs or walking several blocks, but it worsens over time. This symptom affects around 85% of heart failure patients at diagnosis, but many mistake it for being out of shape or getting older. It may also come with a mild cough or chest tightness. If you notice you need to stop to catch your breath during normal activities, seek medical attention immediately, as early diagnosis greatly improves outcomes. 2. Difficulty breathing when lying down, orthopnea. Orthopnea is shortness of breath when lying flat, which improves when sitting up or sleeping with multiple pillows. It happens because, when lying down, blood from the legs and abdomen returns to the weakened heart, causing lung congestion and fluid buildup. People often sleep propped up without realizing it's a sign of worsening heart failure. It appears in about 65% of patients with moderate to severe heart failure and requires urgent medical evaluation. Patients often find they sleep better in a recliner, a clear indication that the heart is overworked. This symptom can also be accompanied by nighttime coughing or a sudden feeling of suffocation. 3. Swelling in legs and ankles, peripheral edema. Peripheral edema is persistent swelling caused by fluid accumulation due to the heart's inability to pump blood effectively. It typically starts in the feet and ankles, affects both sides, and leaves a mark when pressed, pitting edema. It appears in around 75% of patients and tends to worsen by the end of the day. The swelling may progress up the legs, knees, and even the abdomen as heart failure advances. If you notice swelling along with weight gain or shortness of breath, see your doctor immediately. It may signal severe fluid retention or right ventricular failure. Reducing sodium intake and using diuretics are often part of the initial treatment. 4. Persistent cough or wheezing. A dry, persistent cough that doesn't improve with cold medicine or syrups may be an early sign of heart failure. It occurs because fluid in the lungs irritates the bronchi and triggers a reflex cough. Sometimes, the cough produces pink, frothy sputum, a sign of severe lung congestion and a medical emergency. Wheezing may also occur and won't respond to inhalers or asthma treatments. This type of cough often worsens when lying down and improves when sitting up. If you're coughing constantly without an apparent cause, especially with fatigue or shortness of breath, seek immediate medical evaluation. 5. Fatigue and weakness. Profound fatigue is one of the earliest and most ignored symptoms. It's not normal tiredness, it's an overwhelming lack of energy that doesn't improve with rest and can make even simple tasks difficult. It happens because the weakened heart can't pump enough oxygen-rich blood to the muscles and organs. It affects 90% of patients and often appears months or years before other symptoms. It may also be accompanied by lightheadedness or muscle heaviness. If you notice a persistent drop in your energy level that limits your daily activities, get a heart evaluation. Fatigue can improve significantly with the right treatment and lifestyle changes. 6. Sudden nighttime shortness of breath, paroxysmal nocturnal dyspnea. Waking up suddenly gasping for air an hour or two after falling asleep is a sign of advanced heart failure. It occurs because fluid from the legs and abdomen redistributes to the lungs while lying down, creating a sudden sensation of suffocation. Episodes usually last 10 to 30 minutes and improve when sitting or standing. This symptom indicates that the left side of the heart can't handle the increased venous return during sleep. If this happens to you, seek urgent medical attention. It indicates significant lung congestion and the need for treatment adjustment. It often appears along with orthopnea or rapid weight gain. 7. Swollen neck veins, jugular venous distension. Swelling of the neck veins reflects increased pressure in the venous system and occurs when the right side of the heart cannot pump blood efficiently into the lungs. It's a sign of major cardiac dysfunction and systemic fluid overload. It's best observed with the patient reclined at a 45-degree angle. When neck veins are visibly bulging, it means central venous pressure is elevated, an indicator of right ventricular failure. This clinical sign appears in moderate to severe stages of heart failure. If your doctor mentions this finding during an exam, it means you may need more intensive treatment or medication adjustments. 8. Crackling lung sounds, rales. Pulmonary rales are crackling or bubbling sounds heard by a doctor through a stethoscope during inhalation. They indicate fluid in the lungs due to left-sided heart failure. Initially, they are heard at the bases of the lungs but spread upward as the disease progresses. Rales signal early pulmonary edema and significant congestion. Early treatment with diuretics can reverse fluid buildup and ease breathing symptoms. If these sounds occur along with shortness of breath or coughing, prompt medical evaluation is essential. 9. Third heart sound, S3 gallop. An S3 gallop is an extra heart sound that appears just after the normal beat, resembling the rhythm of a galloping horse. It indicates that the ventricles are overloaded with volume or too stiff to fill properly. This sign may appear before visible symptoms and helps doctors detect early heart failure. It occurs during the rapid filling phase of the heart when blood hits a weakened ventricular wall. Its presence is usually associated with reduced ejection fraction and increased filling pressures. Though patients can't feel it, it's one of the most valuable clues for early diagnosis. 10. Rapid weight gain. Gaining several pounds in just a few days can be a clear sign of fluid retention due to heart failure. Each pound, 0.45 kilograms, equals about 500 milliliters of fluid retained in the body. Experts recommend weighing yourself daily at the same time and reporting increases of 2 to 4 pounds, 1 to 2 kilograms, in less than a week. This rapid change means the kidneys are retaining sodium and water due to low cardiac output. Monitoring daily weight helps detect worsening heart failure before severe symptoms appear. Acting early can prevent hospitalization and improve long-term quality of life. 11. Enlarged liver, hepatomegaly. When the right side of the heart fails, blood backs up into the liver, causing it to become swollen and painful. This leads to pain on the right side of the abdomen, nausea, loss of appetite, and a feeling of fullness after small meals. The liver may become tender to the touch and cause discomfort when bending forward. It indicates an advanced stage of heart failure and requires immediate medical attention. If untreated, it can lead to chronic liver damage from prolonged congestion. Timely diagnosis helps prevent secondary liver failure. 12. Fluid buildup in the abdomen, ascites. Ascites is fluid accumulation in the abdomen due to severe venous congestion from right-sided heart failure. It causes abdominal swelling, heaviness, loss of appetite, and a feeling of pressure or tightness. It often appears together with leg swelling, enlarged liver, and shortness of breath. The abdomen may appear tense or distended, making it difficult to move or breathe comfortably. It's a sign of advanced heart failure requiring hospital management and strict fluid control. Paracentesis and medication adjustments can help relieve symptoms in severe cases. Don't wait for your symptoms to worsen. If you notice any of these warning signs, contact your doctor immediately. Early recognition and treatment can save your heart and your life.